we've identified a number of risk factors for cardiovascular disease, for heart disease, and when we talk about heart disease, that's all heart disease together. But the type of heart disease that's really preventable is coronary heart disease. It's where you build up of plaque in arteries, either in the heart or the neck or the brain. And the risk factors are, aside from menopause, are the same in men and women. And so many of the approaches that we use to treat or manage high cholesterol or high blood pressure are the same. What's different, however, is that for a given risk factor, that risk factor may be more or less deadly for women. For instance, for a given dose of cigarettes, say a half pack a day, that is significantly more harmful, more risky behavior for a woman than it is for a man, smoking the same amount. And we don't know if that's body size or the way women metabolize the cigarette smoke. Hypertension is another risk factor that is more deadly. It's more harmful in women. It's also more prevalent in older women, and they have a different type of hypertension in that way. Diabetes is also more common in women than men. And then, of course, we've got the most different risk factor, which is the loss of the protection of estrogen, which occurs at menopause in women. So women at every age have a lower risk of having a heart attack than men do. So at age 40, women are far less likely to have a heart attack than a 40-year-old man. Same goes at 60. By the time women get to be about 70, 75, their risk is pretty much equal. And we believe that it is the protection of estrogen during the premenopausal years that really differentiates and keeps the risk lower in women. And the loss of that estrogen at menopause sort of allows women to catch up, so to speak, with men.